What is the dose rate of oxytocin in goats for retention of placenta? We will find the answer of this question from Plum's Veterinary Handbook, Veterinary Pharmacology and Therapeutics by Jim A. Reverie, and Veterinary Medicine Textbook of Diseases of Cattle, Horses, Sheep, Pig and Goats by Kenneth W. H. Blake. These all are the most authentic books of veterinary sciences. So, and this is the company that makes this medicine named as oxytocin S solution. They have given the dose rate both as ml and as mg per ml as international units and as mg per ml. So according to them, the dose rate of goat is 0.2 to 1 ml, or we can consider, if we consider the maximum dose, it will be the maximum dose is 1 ml, 1 ml or 0.18 mg, as 1 ml has 0.18 mg. We can say that, and every ml has 10 international units. So we can say that the maximum dose rate is 10 international units or 0.18 mg. We will compare these doses with the textbooks. So this is the Plum's veterinary drug handbook. According to that, it is 10 to 20 units of oxytocin for retained placenta in patients with uterine atony in sheep and goats. So 10 to 20 international units means it is approximately same as that of the manufacturer, as it was the 10 international units. So Plum's veterinary book is information is can be said to be correct. And if we go to veterinary pharmacology and therapeutics, it is telling that the dose rate of at the page number 721 of ninth edition, it is telling that the dose of oxytocin is 30 to 50 units of sheep. It is not correct, as the previously the Plums is maximum dose rate is was 20 units, and according to manufacturer, they are suggesting 10 international units. 10 international units by manufacturer, or it can be go maximum to 20 international units according to Plums, but it is going more. The dose rate is even more in veterinary pharmacology, 30 to 50 units. 30 to 50 units. I think it is not accurate, or I was unable to understand what is the difference between units and international units, because veterinary pharmacology is telling about the units, and no manufacturer tell that their drug has how many units. They simply tell on their medicine they write as international units. So international, they do not write units. So the veterinary pharmacology information is little bit confusing or not true. They are not telling what is the how to convert the units into international units, like that. So it is overdose as compared to the authentic dose. Veterinary pharmacology is telling the dose that is more than that of the authentic dose uh, by the manufacturer. And if we see the veterinary pharmacology 11th edition, at page number 228, page number 228 of 11th edition, they are telling its dose as 0.1 mg per kg, 0.1 mg per kg. And if we compare it later on with the manufacturer, then like that, 0.1 mg, 0.1 mg, or if we multiply the 0.1 mg with the 25, then it will be 2.5 mg. It will be 2.5 mg for 25 kilogram of goats. But the authentic or the manufacturer recommendation is 0.18 mg. So we can say that the DC blood dose rate is 13 times more than that of the actual dose or the manufacturer dose. Well, we have considered this example by considering the weight of the goat to be 25 kg. Multiply 0.18, multiply by 25, it will be 2.5 mg, or 2.5 mg mean, according to DC blood, we have to uh, inject 2.5 mg, but according to the manufacturer, we only have to inject 0.18 mg, or 13 times less than that of the DC blood recommended dose, and half of the dose as recommended by the veterinary pharmacology textbook. So this is the book that is recommended by Higher Education Commission Pakistan, and this is the PDF in which they have tell that which books are recommended and which books are not recommended. The book that has given true information about the drug dosing was the Plum's Veterinary Handbook, and even we cannot find its name if we write only Plum, then it was zero results, and this PDF is of 102 pages, means that even HEC has not considered that authentic book to be considered in the DEM curriculum. And there is a PDF file that is shared among all the veterinary colleges. This is, we can say that this is the notes that are taught. Every DVM of Pakistani students have this PDF file. So according to that, it is the for small L means large ruminant, S means small ruminant. Small ruminant means the sheep and goats. They recommend that 1 ml and each ml, if each ml has 10 international units. According to that PDF file, the dose rate of oxytocin should be 10 international units, and the 10 international units. This PDF file also have the correct information. So in summary, we can say that uh, the Plum Veterinary book is providing correct information, and it is according to that of the its dosage is as per is same as that of the manufacturer recommendation dose rate, and this dose rate are same. Veterinary pharmacology, they are telling the dose rate as a unit, not as international unit, and it is difficult, or I cannot find a way to convert the units or international units. And veterinary medicine book, they have provided 13 times more than that of the recommended dose if we compare it to the manufacturer recommendation. And the HEC recommended a PDF file. No, the PDF file that is commonly shared in Pakistani veterinary universities, it is also providing a correct information.